Okay, I think we'll start. So good morning, everyone. I'm José Luis Fernandez, Director of the Care Policy and Evaluation Center at the LTC, CPEC, and I've got the very nice job of introducing this first session of this wonderful two-day workshop on the COVID-19 and the impact on the long-term care systems. As I was saying, really nice task for me. I don't want to take too much time, but before I introduce this first session, I was just going to say a couple of words about my reactions to seeing the wonderful two-day program. Before I go on, however, I will say I'll remind everyone that the event is being recorded and then will be put online so that people that might not be able to attend over these 2 days are able to benefit from all the presentations. So just to let you know about this. But anyway, in terms of the program, what a wonderful program, what a rich program. I think sometimes we can be tempted to think about long-term care and COVID-19 as perhaps an issue that is soon to be resolved, and therefore that might become relatively obsolete as a research topic soon. And very sadly, of course, the Omicron, for example, developments are demonstrating how that's not likely to be the case anytime soon, as well as obviously all the long-term consequences of the impact of long-term care on long-term care needs of COVID-19. So obviously this is a workshop that is very, very important today, but is likely to remain very important for in the future. I was just looking at the program again this morning and quickly looking at the richness of the program, which I think includes presentations from at least 20 different countries, covers 5 or 6 different continents, looks at issues from a range of perspectives, national, local, different types of services, covers a range of client groups. It's not just about older people. It includes sessions on people with learning disabilities, carers, workforce. So it's an incredibly well put together program, which is, I think, going to leave a little bit of a legacy. It also includes, and I think this is really really important, sessions on methodology, on research and methodology, because obviously this is an area where decisions have had to be made in the context of a growing body of evidence, starting from zero at the very beginning, and the work that LTCcovid has been doing over the last 3 years has been incredible in terms of synthesizing and putting together recommendations on the basis of the emerging evidence around the impact of COVID-19 on long-term care systems. And I think one really, really interesting development is this launch of the living report on COVID and long-term care, which Adelina is going to say more in a second about. But this is really, I mean, from a methodology perspective, is really, really important, I think, development. So anyway, I'm not going to say anything more other than, again, to say how pleased I am that we're hosting the event. The event feels a little bit like a marathon. It's, I think, today is only 10 hours with 30 minutes breaks. So, I think people are expected to just go and grab a cup of tea or coffee and come back. But anyway, without any further ado, I wanted to first of all introduce the next speaker in this session. The first session is trying to set the context in terms of an overview of international experience on the impact of COVID-19 on long-term care systems. The first speaker is Trevor Farmer, who is a member of the Social Care COVID Recovery and Resilience Project, which is really leading this living report, and he's a member of the Public Involvement and Engagement Group. So without any further ado, Trevor, take it over to you.
Okay, good morning. Right, first of all, I'm Trevor Farmer. I'm speaking from South Wales. I'm actually supported by social care, and I have over 25 years of lived experience of having home care to support me. And I'm also a member of the National Partnership Board of Social Care Wales and a director of Disability Wales. So I get to hear and to have access to lots of information that's going on. Anyway, I've looked through this report, and I've got a couple of things I'd like to comment on. You know, you're looking for policies and such like. Well, policies are for academics and politicians to sort out. I'm not an academic, I'm just somebody with lived experience. But I've got some comments, and I think first of all, in part one, I think it's 1.11, workforce conditions, pay, employment conditions, qualifications and levels, and shortages in care providers. Right, but this is something that's very relevant. You know, I have 4 carers a day coming into my house, 2 at a time, to get me up and put me to bed and the other bits and pieces. So I get to hear, and this has happened over a period of 25 years, and so I get to hear all the gossip, if you like, and the talk. Right, there's some serious issues here, and first of all, the pay conditions are very, very low. Minimum wage, most of the carers are on. And secondly, they have to put in a lot of hours. Most of them are don't have contracts, and they have to provide their own vehicles. In Wales, they even have to pay £30 a year to sign up to Social Care Wales to be registered to operate, and it's not a good thing. And I've studied this, and I've looked at it, and I've rather than a policy, what policy can you have? I think I look at solutions, the way my own mind works, and I've together with a few other people who are also supported by social care and domiciliary care to be able to live, we've come up with what we consider to be a way out of this. I'm just going to, I know this is not part of the report, but I just want to put it forward because I think it might be quite relevant to think about. Right. But I don't think they should be actually called carers. I think they should be called auxiliary home care, auxiliary home support nurses. They should be paid a minimum wage of £15 an hour as opposed to £10 an hour they're earning now. They should actually be trained to do slightly more than the care work they're doing at the moment. And I'm a bit of a number cruncher. And I sat down and I worked out that over this is in Wales, that over the next 3 years, it would actually save £53 million, because by doing this, it would free up so many beds in hospitals. It would save the NHS, because it would. There's so many people in hospitals who can't. They're old people or people who need some home care support, and they can't get it, so they're blocking up beds. It would free up that straight away, and but it wouldn't be straight away over a period of a couple of years. And it would, to me, that's a solution. And I think it's something we should certainly look at, should be looked into. Okay, that's one point. Now, if we skip to part 3 of the report, I think it was section 3.12, the measures to support unpaid carers. Right, unpaid carers, they are so important. To me, they're the forgotten support network because they're forgotten. There's more unpaid carers than what there is paid carers for a start, but they don't have any support at all. Okay, they might be receiving some benefit to minimum benefits, which is absolutely nothing really. It's less than a day's work per month, and less than half a day's average pay per month for one day. And it's they're doing a lot of work, and I can be, my wife is an unpaid carer, and she has to support me quite a lot. But there's been absolutely, during this whole COVID pandemic, there's been no support at all that she can have access to help guide her, to help her, because all of a sudden, for 3 months during the lockdown, we had to cancel my home care because most of the carers a lot of my carers had COVID, and because they're visiting 20 or 30 different people a day, and so my wife had to take care of me. Lucky enough, I'm able to communicate well enough to help through it. Now, there's nowhere she could go to try and get some advice or some help on anything for her own psychological needs more than anything else, I think. And that's something which we have to take into consideration with unpaid carers. That sort of, there's no support network. And the other thing I wanted to mention, we go down to part 3.
Trevor, briefly, if you may, we've got 1 minute left.
Oh dear, sorry, I have to go on a little bit. Just on part 3, number 3.07.03, care home visiting. This is feedback which I've been getting through my various networks. Families being able to not be able to have access to their loved ones in home care, in the care homes, is very serious now. I won't go into it fully because I'm running out of time, but yeah, I very want to quickly say that I feel honoured to have been asked to speak today, and I hope to be able to spend as much time as possible sort of listening into the workshop. Anyway, thank you very much for listening to me.
Thank you very much, Trevor. You've highlighted 3 areas, and there'll be loads of discussion around those 3 key areas: workforce, unpaid carers, human rights in the program today, and tomorrow. So looking forward to people's ideas around that. And Adelina has already highlighted ways in which there are questions in the report which relate to the points that we're making, so ways of contributing there as well. One thing I should say is, if you've got questions, please either note them on the chat, and we'll try to give you the chance to ask those questions, or raise your hand digitally, and then we'll come to you. So our next speaker is Paola Sillitti from OECD, and she's going to give us an overview of the OECD report on the impact of COVID-19 on long-term care systems. So Paola, over to you.
Thank you. Let me just give me just a second to share my screen. And you should be able to see the main slide. Okay. So yeah, my presentation will focus on the main challenges and policy responses to COVID-19 across OECD countries, specifically, of course, for the long-term care sector. As you mentioned, all the results come from our latest publication on COVID-19 in long-term care, which I have already shared in the chat, and I will share again after my presentation, so you can have access and have a closer look. So before we start, I thought it was important to remind you something that you already know. So the importance of the sizable share of COVID-19 deaths that has been in the long-term care sector across OECD countries. Around 40% of COVID-19 deaths has been in the long-term care sector. And of course, the cross-country comparison always requires some caution, because there have been different ways of calculating COVID-19 deaths across OECD countries. Another result we found in our analysis is that the long-term care sector was not sufficiently prepared for an emergency, such as the COVID-19 pandemic. Even those countries that had some form of emergency preparedness system were often overlooking the long-term care sector before the COVID-19 pandemic. Luckily, on the bright side, since the pandemic, the number of infection control guidelines in long-term care in OECD countries have stepped up. And then moving to the core of our presentation, so the main challenges and policy responses. One of the main challenges for OECD countries was definitely the lack of testing at the beginning of the pandemic, which hampered contact tracing. There was a lack of knowledge of the use of testing for long-term care workers. But luckily, 60% of OECD countries had policies to improve testing early on in the pandemic. In particular, in 13 countries, there was training for long-term care workers for the use of testing, and 11 countries set up mobile teams inside the long-term care facilities to avoid the movement of residents across settings to get tested. Finally, most countries publicly funded the testing, and in 10 countries, governments provided extra funding to the facilities for testing. There were also some countries that provided additional measures. For instance, in Germany, it was the armed force that was financed to perform testing inside the facilities, while in Greece, the hospitals were able to provide free rapid tests to long-term care facilities. Another issue that was highlighted as one of the main ones at the beginning of the pandemic, as we all know, was the lack of personal protective equipment across OECD countries, in a ranking from 1 as not an issue to 5 as extremely challenging. Countries defined the access to PPE as a 3 and the access to testing as a 4. And as you can see from the chart, still during the period June-August 2020, there was a sizable share of long-term care home workers who were not able to wear personal protective equipment when working, although this share was very varied a lot across OECD countries. Again, even for this issue, countries were able to react quite promptly. Between March and April 2020, all countries applied policies to ensure the provision of PPE was adequate. So most countries issued guidelines early on in 2020, but also all surveyed countries in 2021 were already stockpiling PPEs. And for instance, in Norway, there was a web-based tool that was given for free from the national government to municipalities in order to calculate the right amount of PPEs to be stockpiled. And most governments funded PPE with a few exceptions. For instance, in Lithuania, home care recipients had to pay for their own PPEs. And in Czech Republic and Colombia, workers were asked to participate, to contribute to the purchase of equipment. Of course, another issue for OECD countries was the community living for long-term care. So the higher facility density and bigger size of facilities were associated with higher infection rates. For this reason, there were visiting restrictions applied, as well as a reduction in group activities. But at the same time, it was really complicated for countries to balance the need of reducing the risk of contagion and at the same time ensure a good quality of life for people inside the facilities. So for this reason, many countries modified the visiting restrictions and the restrictions in group activities over the time according to the pandemic. And for instance, visiting restrictions were relaxed for people reaching the end of life. But also in some countries, visiting was later on allowed, but with some restrictions, for instance, in the number of people allowed, or preferring visitors to be outdoors, to stay outdoors. And also group activities, for instance, in Denmark, group activities were reduced in the number, and they were organized with shifts in order to avoid overcrowding closed spaces. There was a particular challenge and a particular concern regarding people with dementia, because for them it can be particularly complicated to understand and remember the reasons behind the restrictions in visiting and group activities. Another issue that is a long-standing issue in OECD country in the long-term care system is the care integration and coordination with primary care and with hospitals. During the pandemic, the care coordination improved, with 8 OECD countries introducing measures to improve coordination with primary care, and 7 OECD countries introducing guidelines for integration with hospitals. Still more could be done, but it's also important to remind that the digitalization, the use of digital tools in the health system was very useful to improve both coordination and care continuity during the pandemic. A last issue that is worth, of course, mentioning is the issue of the lack of staff, of adequate staff, so staff shortages, but also poor working condition. Of course, OECD countries took measures to improve both working condition and staff shortages, but I will not dig further into this topic because tomorrow there will be a colleague of mine making another presentation specifically on workforce in OECD countries. So I will let her dig deeper into the topic. And finally, just let me thank you all, and let me remind you that we can keep in touch either via email or on social networks, but also please feel free to visit our website and read our latest publication. We have recently published the study I've just presented, but also Health at a Glance 2021. So thank you all.
Thank you very much, Paola. So we've got a little bit of time now for a few questions. So open to really the floor. As I say, you can either write your question on the chat or just raise your hand. Perhaps, Camille, are you raising your hand, or are you, no? Oh, you're so I'll ask you a question, Paola, if I may. So obviously, different countries have been affected to a different extent, partly because of the measures that have been taken locally. And I was wondering whether, in describing the differences, both in terms of the impacts across countries, but also of the issues in different countries, whether you are now able to sort of draw some conclusions in terms of which are the factors that have led to differences in policymaking responses to, is it about resources, is it about information, is it about the public? Can you now draw back and think about which factors led to differences in responses?
Thank you. That's a very interesting question. Thanks a lot. So definitely it is always hard when looking at the current crisis we are still living to draw conclusions. But what I can say is that we did realize that different countries were hit in different ways because of a series of reasons, and reacted in different ways because of a series of reasons. Definitely the timing in which countries were affected was one factor. Some countries were affected in a more unexpected way. For instance, Italy in Europe was the first among the first countries hit. So it was particularly difficult to have a prompt reaction, while for other countries might have been slightly easier to react, drawing on other countries' reactions. Some countries were also better prepared for a pandemic because they had some experience with previous epidemics, for instance, Asian countries. So that was also another factor. Of course, always funding and the structure of the long-term care system is also definitely another reason for differences across countries. So of course there is not a precise set of reasons, but these are the main reasons we could highlight in our report, definitely.
Thank you very much, Paola. All right, so we can have further questions after the next presentations, but let's just move to Adelina Comas-Herrera, who's my colleague at the Care Policy and Evaluation Center, and she's going to introduce the Living Report on long-term care and COVID.
Hi, thank you very much. Actually, there is a question from Diane.
Oh,
so
sorry, I haven't seen
it.
Is it in the chat? So Diane, can you please ask your question? Sorry, I apologize, I didn't see it.
Sorry, it's a very basic question. It was just, could Paola just say what the country codes were that she used in her slides, please? Or just put it in the chat, that's fine.
Okay, I will. Do you mean the country codes in the care integration slides?
Yes, some of them I could make out, I think. Like FR, I presume, is France, and HU is Hungary. But it was just some of the others I was struggling with.
let me just write them in the chat so it's quicker.
But presumably the report will have that information as well.
Yes, definitely. Okay. Definitely.
Great.
Thank you.
Thank you very much. Adelina.
Okay, now I have to start. So thank you very much, everyone, for coming today, and thank you to all the co-presenters, Jose Luis, for chairing. I'm just going to say that we thought this was going to be a 2 or 3 hour event, and then so many people wanted to present that it ended up being 2 days, and it's actually amazing. And I know there are people that would have presented as well if we had had more time. So thank you everyone for your support. Today the excuse to have this this workshop, which I think was very timely as well for many other reasons, is that we're launching, or we're showing to the world something we've been working on behind the scenes. We've been working on how to develop the LTC COVID website, and we have this thing called Living International Report on COVID-19 and long-term care, and it's a way of trying to adapt to these rapidly moving times when the minute you write the publication or report is already out of date, and we're trying to find a way to cope with this changing situation. So to start, I just wanted to do an acknowledgement. So I mean, when the pandemic started, from my point of view as an academic, what we have had is perhaps one of the biggest in my area ever collaborations that was incredibly heartwarming, and I'd like to thank everyone who has shared their knowledge, their expertise through LTC COVID and in so many other ways, through so many other channels. I've put here the support, but we are partly also having some support from the National Institute for Health through a research project that I'll mention later. Also, the International Long-Term Care Policy Network is where a lot of the people who contributed initially came from, and also from the LSE through the Care Policy and Evaluation Center. But of course, any errors are my responsibility. So just to tell you the story of LTC COVID, this is was a spontaneous collaboration. It started in March 2020, because there was we were starting to see some news about what was happening in the care sector, and of course many of us had been worrying about what would happen in the care sector even earlier, and this was a way to bring together all this information we were all collecting and our initial understanding of the way things were looking, and having a way, it was a bit of like a blog initially to document all this early media evidence, and then we were able to, through all this amazing network of long-term care experts, to put these events in the context of long-term care systems. As I said, this initially was supported by the International Long-Term Care Policy Network and CPEC. These also, in terms of financial support, enabled us to develop the website, and there was also some research assistance. We're currently also working through the Social Care COVID Recovery and Resilience project, and I'll mention that later. And it's been wonderful to see a growing number of publications from international collaborations that have come from this report, for example, on mortality, on visiting policies, the sector of ownership, and hopefully we'll see more. I had to look at how many people have visited the website since it started in March, and as of yesterday, last night, we've had 376,000 visits, which is a lot. And when we started, we had this ambition that if we got then Greenland to cover, we have quite a lot of the world map. We actually do. There's a few countries in Africa and a couple in Asia we haven't reached, and hopefully over time we'll be able to not only have people visiting, but also sharing information as well about the impacts of the pandemic on people who rely on care in those countries. So we've covered 207 countries and territories, and we also have a newsletter that sends automated messages whenever we do a post, and at the moment we have almost 1,000 subscribers. It's quite amazing for something that started as a bit of a spontaneous response. In terms of what's in LTC COVID, so we've got the International Living Report, and that's what we're launching today. I'm just going to click to see if this works, and if it doesn't seem to work, so never mind. So I'll show it to you in a minute. We also have a network of experts. Actually, it seems to be working now. Can you see my shared screen or not?
So we can see what's in LTCcovid.org ? Is that what you?
Okay, no. So I was clicking and linking, but I think I may need to share separately, and I will do that later. Thank you. We also have been creating summaries of evidence, and we have had a very lively and rich series of webinars. And we also have a database of research projects on COVID and long-term care. And of course, we have the blog, which is basically, we now call it highlights, but it's a way of sharing anything that anybody working in this area would like to share and highlight and reach more people. So that's pretty much what we've been doing so far. And I'd like to now tell you a bit more about this LTC COVID International Living Report. The concept is a bit like a wiki, and as I said, this is to help us keep up with the rapidly changing nature of the situation, and the fact that more and more people are now have written reports and articles in lots of different places. That means that we don't need to have everything on this website, that what we can do is to offer a platform to link to all these other publications people are doing. So the idea is that it's like a wiki, so it's somewhere that you go and find out where you can find out more about each of the topics. It's a collaborative report in the sense that anybody who has some knowledge and expertise in this area can come and share and contribute. And it could be that you know about one question in your country, one area, that's your area of specialty. You can come and contribute on that question. You don't have to write a whole report on the whole country, on every aspect of long-term care and COVID by yourself. And this can also be added to and updated directly through a system that we have by the people that are approved in the website as contributors. And I'll tell you why we are approving and why we're also approving the posts. And the very first day we opened up the facility for people to start signing up as experts, we did have a series of people who had very strong opinions about vaccination, quickly trying to come in, and we do have to have a moderation in place, and as long as you have demonstrably written something on long-term care ever in your life, and you don't have very strong opinions on topics that we're not really addressing, like effectiveness of vaccines or secondary effects, then you'll be very welcome here. The wiki is structured around 64 questions, and it was wonderful how Trevor has highlighted 3 of them already. These questions can be answered for every country and region in the world. And we are also creating these contributor profiles, which I hope will help as a way of a thank you, recognize the expertise of all the people contributing and showcase their other publications and their institutions as well. So hopefully this is an incentive as well to be in the website. We have the possibility of expanding the questions in the living report, and we hope that this might be helpful to future research collaborations or future developments. And we might be able to get additional funding through some projects that help us go more deeply into some of the topics that are emerging as very important. And if you're interested in signing up as a contributor, I have put my email in the box, and we are not sharing publicly the link. As I said, this is a very hot topic, COVID, and we have had a bit more traffic than we wanted on the website sometimes due to that. And in terms of how we came up with these 64 questions, so we started with reading all the 33 LTC COVID country reports that were published mostly during 2020. We also, and I will show it to you, we also built in as a bit of a framework, the social care COVID-19 recovery and resilience theory of change. We drew on, of course, the growing literature on COVID and long-term care, and we have also been inspired, and I'm very happy to admit that, by the European Health Observatory, which has something fantastic for healthcare. It does have a bit of information on long-term care, but I think it was very clear in the pandemic that we needed a much more in-depth website that was focusing on long-term care with many more questions than what you normally find in a health systems oriented platform. So just to show you a bit what would be the framework behind the report, we have drawn a lot. It's not direct, but it's been really very much informed by the theory of change we carried out to map a path towards recovery and resilience. This was for England through the Social Care Recovery and Resilience Project. And I've put in a link here. You can find it actually on the research projects part of the website. And this project aims to draw lessons for policy and practice from international COVID-19 experience and scientific evidence to support the English social care sector. And this is so that the English social care sector can recover from COVID-19 in the short term. It can withstand better future waves of COVID-19, similar shocks in the medium term, and it is to become more resilient in the long term. The project is funded by the National Institute of Health Research, Department of Health and Social Care in the UK. And it's what we did, the theory of change. I won't go into what it is now, but we actually gave a webinar on this and have some slides we can share as well. But it's a workshop with a wide range of stakeholders involved in social care in England, including experts by experience. And in fact, Trevor was also taking part. And what we do collectively is to map a path towards situation. And this situation is one in which, and here this is something we agreed between us, that this would be a good impact to wish for, that the social care sector in England is resilient and able to withstand ongoing and future shocks, as well as prepared for future infectious disease outbreaks, that people who are supported by long-term care can recover from the impacts of the pandemic, maintain their autonomy, and are able to live independent and fulfilling lives, and that providers of long-term care, including unpaid carers, can recover from the impacts of the pandemic and have a good quality of life, well-being, and decent work. So this is what the impacts that with the stakeholders were agreed as what we were going to map a path towards in the theory of change. The theory of change looks like this. There's no way you can read these, but we will share the slides, and you do need a magnifier to be able to actually read it. And we do have actually behind this, there are about 560 items of information that were developed during the workshop, and that we're still actually analyzing and organizing in order to develop this detailed roadmap. But what I want to show you is in these yellow stickers, I'm just going to do a very brutal summary of what looks like the key path towards recovery and resilience for social care in England. And I think that this I'd be surprised if this isn't something similar for many of the other countries that many of you come from. And the first item that came up was that, and the first idea was that the care sector learns from experience and evidence, including from the experience and the knowledge of people who use care and frontline staff. So that's the first condition to be able to achieve these impacts. We agreed that there is a co-developed evidence-informed roadmap so that towards recovery and to deal with ongoing COVID, and that this is adopted and funded, that the sector is able to respond to the changing COVID situation. Of course, it's very clear at the moment we're dealing with Omicron, how important it is that we don't just take this for granted, oh, it's over when the numbers are getting better. We have to keep being ready. That the sector is able to support people who use and provide care to recover. And by recovery here, we mean psychological, physical, in every way. And then we start, and this is very much about COVID, this sort of lighter blue boxes. But then the workshop was looking also more at the longer term recovery and strengthening the long-term care systems to be able to provide this longer term improved care system impacts. And a very important issue that was raised was that successful innovations would be kept and built on, and that the learning from the pandemic would be captured so that it leads to and optimized so that we lead to increase public and political will for reform. It has been a really serious situation at huge personal cost to so many people, and it's really important that this is then translated into something better. The mechanism for this, and this is just one box for something that is of course extremely complex to achieve and is really, really a very big task. This is that the country would reach a new national settlement that would address governance, funding, data coverage, including a workforce strategy that really needs the governance funding also to be addressed for it to be a realistic situation, that the voice is heard of people who use and provide care, both unpaid carers and paid carers, and that their rights are upheld properly, that we have a system that leaves no one behind, including unpaid carers. And it was really, thank you, Trevor, for bringing that up as one of the groups that have been very much forgotten in the pandemic. And so that went very quickly, but what we basically where we have now is an idea of how dealing with the pandemic and then being able to recover from this should be very much seen in this effort towards building better care systems. And today's workshop is going to try to look at both. To look at the pandemic, but also to look at where we're going and how things can look better. And we have some really nice sessions later that I hope you'll enjoy. So what's in the International Living Report? It's structured in 4 parts. The first part is looking at what we had before the pandemic, the long-term care system characteristics and preparedness. The second part is looking at the impacts, and this is with an S because there are multiple, of the COVID-19 pandemic on people who use and provide care. When we say people who provide long-term care, we mean both unpaid carers and we mean paid carers. That part 3 is looking a bit like Paola has also explained at the measures adopted to minimize the impact of the pandemic on people who again use and provide long-term care. And we also want to understand what worked and how. So if you have been doing research on this, please come and highlight it. Part 4 is very future-looking. It's looking at the reforms to address all these structural weaknesses of long-term care systems that have become so apparent in the pandemic, and how to improve preparedness for future pandemics and other emergencies that may reach us. And in the context of climate change, it's important perhaps to have a broader look to just thinking about pandemics affecting people in this sector. And here is the link. I think it's been shared in the box. And now I'm going to tell you a bit more about what it is that you'll find when you look here. So I wanted to calculate how far we were, because somebody asked me, oh, when will be the report ready? And actually, this is not a report that I think will ever be ready, because this is like a wiki. This is a living report. This is something that hopefully will grow every day. In fact, has been growing every day since we started assembling the questions earlier in the summer. And so I calculated, so we have 64 questions. And I think there are over 253 countries, territories in the world, and that's not including the subnational level, which of course we are also able to showcase in this report. We could have a total of 16,192 questions answered. And because we've had by now, I think at least last night, hopefully there's one or two more already, 842 questions answered. So far, we've only completed 5.2% of this report. And it doesn't sound like a lot to go to launch a report with that, but this is very much, we're sharing it with you because we think there's enough there to show you what this tool can do, and hopefully to invite many of you to feel motivated to contribute to this endeavor. And I do hope that you will find this useful if you're working in this area so that people can find your work. And of course, we hope that we'll be contributing to the efforts of policymakers, stakeholders, people in the sector, not only to mitigate the impacts of COVID, but to reimagine and improve care so that we can support learning from the experience of other countries. And I'm going to now quickly go onto the website and see if that will work. And let me just share the screen again. All right, so this is, can you now see the website? Somebody let me know.
Yeah.
Thank you. So we have overnight changed what's in it when you look at the website. And here we have the International Living Report. So if you click here, hopefully it won't be too slow. You've basically find the report. What we weren't sure how to publish it, because of course it's always a little bit, what to call it, but we're very grateful to LSE to help us get a digital object identification number that you can click on. We're going to have to let them know every now and then how to update the number or the names of all the people who have contributed. As I said, it's a wiki-style report. So here are the 64 questions that we have, quite a lot of them. And we're trying to keep an updated growing list of the number of people who have so far contributed. Most of them have now created what we call expert profiles. And here I'm going to highlight, for example, my colleague Clara Lorenz-Dant, who's been involved in this from the beginning, from LSE. And you can find out about her bio, her research interests, her areas of expertise. And I'm going to now quickly go back and show you. So for example, one of the questions that Trevor was highlighting were care homes visiting policies and the access of unpaid carers to care homes. And you can look at the whole section here. We usually, and we will be building this over time, where we'll be providing an overview for each question internationally. At the moment, we haven't had time to put a lot in, and also provide links to the key international reports in this area. And then you can scroll and you can read what we have for all these countries. And if you want to print it and read it as a proper report, we have this version that basically you can copy and paste into a document, and you can read, and you can see as well that, and in fact, this one we drew a lot from a joint report already, but you can see, for example, that in Iceland, the questions came through somebody in Iceland authorities, and you can also click back into her profile here and find out more about her role and her work. And to go back to the report, I just want to show you, so I'm going to actually show you, this is the experts profiles that we have so far. And if you haven't got the profile already, please let us know, we'll show you how to do it. As I said, we're not sharing the link publicly, but we will give you access if you ask us, and we can see that you're a bona fide long-term care person. And we can also access these by country, and we will see a bit more about that later. These are the countries that are the most complete so far. There are quite a few countries for which we have answers, but we want to give a bit more time to build up more before we show them to you. But I'm just going to show you what we have for Poland. We have a front page for each country, which is like a profile page. And here you can access questions from the report. You can see the people who've contributed so far, in that case, my LSE colleague Joanna Marzak, and also Agnieszka Sołakowta, also from Poland. And you can see also a bit more on other things that we have on the website on Poland. So for example, we have some research projects in the research project database on Poland that you can look at and you can find out more about. So that's what we have. Again, you can read a printable version of this country profile, that it's a bit like as if you had a traditional report that is drawn automatically and is always up to date. So you can see every question when it was updated and by whom. And hopefully this will also be a useful way for you to be able to contribute. And I think that it gives you enough of a overview. Feel free to go in and play with it, make it yours, send us as much as you can. There's a few countries where we have answers. I haven't showcased them separately as countries, just to give people a bit more time to build them up. But as I said, we have 840 items so far, and they can all be improved, and they can all draw more from your expertise. So thank you very much.
Thank you very much, Adelina. So what a wonderful resource, and a call to action from Adelina to what do you want to achieve? 20% by tomorrow, is that the goal?
I don't know if we can process so much, especially while we're at the workshop, but you know. And I wanted to say, you can contribute either directly logging into the system, and I'm going to mention, we have a colleague, Daisy Farrell, who is actually will have about 1 day a week for a while to be able to help us with uploading and editing and supporting the process. So really delighted to welcome Daisy as well. And many other colleagues from LSE, William Bird, and Natasha Kara. You'll meet some of them today and at other occasions, who have done a fantastic job helping us build things up. And please don't be shy. This is for you to advertise your work if you're working in this area, to help more people find it. So just come and show us all the wonderful work you do.
And we've got some time for comments and questions to both Adelina and Paola. There's already a very expressive wow in the chat from Peter Lloyd Sherlock. And also, Catherine, would you like to just a comment about the wonderful contribution that LTCcovid has made to policy making? Catherine, did you want to say any more?
Well, only that obviously you've put me on the spot, but just, you know, I'm in awe of where we've come from, and I think what this is highlighted is not only a general concern globally, but the fact is that so many academics are working in this field, but also as well having a voice for carers and for care home and residents and relatives. So I suppose my only question is, because I know this is funded, is how we keep that momentum and the sustainability, that question that we constantly get asked, what happens once the funding stops? So perhaps I'll pose that question without putting too much of Adelina on the spot there.
Thank you very much. Just the right spot.
Right, I mean, we're not lacking imagination here. And I do think, I mean, we do have the international long-term care policy network already. We've kind of got a bit distracted with COVID, but we do have already some place to start to build up international collaboration. And I do think there's so many of you, of us, so many research centers that I do hope we find a good mechanism to come together and watch this space, because we are trying to begin to think of some ideas. At the moment, actually, I said this project was funded until June. We do have an extension until September, so we get a bit further. But I hope also that there will be other research projects that some of you are involved in that may find this a useful tool, for example, for knowledge exchange, and that we may be able to build little by little, but growing international collaborations that help support this as a collective endeavor.
Thank you very much. Oscar, Brito Fernandez, do you want to ask your question?
Yeah, so first of all, I want to congratulate for this amazing work. You've been supporting us throughout the beginning and sharing learnings across the globe. So thank you so very much. Just some reflections and building on the sustainability of the network and the quality of the information available. Will there be some kind of peer review to the information that will be shared? And this is a challenge, of course, something to start thinking of. Could this be the start of a community of practice of researchers that are focusing on developing policies to foster nursing homes and develop the social sector? And my other question, probably a different iteration of the Living Report. Are there plans to have a report that is easily available and easy to navigate to nursing home staff and to nursing home managers? Because often they are overwhelmed with the scientific side of the information that is available to them, and how does that translate into their practice? I know these are challenges. We are only starting, but if there are plans, and what are your thoughts on these issues? Thank you so very much.
Are you volunteering to help build this translation for the nursing homes? It would be fantastic. So, I mean, there's a lot of things that we can do, and I do hope that we can find partners in crime, not in crime, but you know what I mean, but that we can find partnerships to help develop additional projects, and that's partly also why we created this experts directory. I mean, experts, I like to use this word because I think everybody here deserves it, and but we have put in areas of interest and countries. So I do hope that we can generate a bit of discussion. I didn't mention that because we didn't have time to develop it. We're also going to develop a contributors private page where you can post a notice and say, look, I have an idea to do something, who wants to join? And see if you can find people who can work. All these ideas are being recorded, and I hope that we will find channels for all these collaborations. Thank you.
Thank you very much. We probably have got time for one more question. I don't think there's anyone. I was gonna then ask one brief one of
the peer reviewing. Sorry.
Sorry.
The peer reviewing. At the moment, this is a bit of an autocracy, so it's being done through our team at LSE just because we have the funding. But I mean, I don't. You know, if we keep going with this for a while, we need to find a more collaborative model. We are basically checking every link that is sent and reading every piece of text before it's approved onto the website. And just to check that, you know, the information, I mean, sometimes we struggle because it's in Chinese or in Hebrew, and, you know, Google Translate has its limitations, but we at the moment, it's being done in-house, but obviously if this grew even more, if we reach the 16,000 questions, we may need to grow the team that helps with that.
Thank you very much. Well, so we've reached the end of this session. I think it's a wonderful start to a great 2 days. And so all we've got left is really to thank Adelina, Paola, and Trevor for their great contributions, and just looking forward to the rest of the program. So we've got 3 minutes to grab the first cup of tea of the day, and I expect there might be quite a few. So thank you very much.